Oh, hi, good afternoon, everybody. Um, Thank you so much for joining us today. Simon, did you already start with the housekeeping rules, or do you want to start with that?
No, I have not yet because we were just trying to get everyone on. Hello, everybody. This is Simon Bukel. Just a couple house rules that we want to share before we get going. First, this event is being live captioned. There is a CC button at the bottom of your screen. Turn that on. You will also be able to adjust the text settings there. If it's not working for any reason, just message us through the chat function and we'll look into it, but it does appear to be working at the moment. Second, everyone is muted on this call, as you saw from the beginning here, because there are a lot of folks. We had over 200 people register, so we anticipate more people will be joining as we go through this hour. If you do want to ask a question, there is a raise your hand function, which you can do, or even easier, just shoot your questions into the chat function and we'll monitor those. We'll try to answer as many as we can. We can't promise we'll get to everything. But also just please keep in mind that we cannot give personal medical advice on this call. So please just keep your questions a little more general or generic to the community. This event is being recorded and we will post it online afterwards. After the call is over, we will be posting coronavirus or COVID-19 updates on our website, and the link is there, ctf.org/COVID-19. And of course, you can always reach us at info@ctf.org at any time. And now I'd like to turn it over to Annette Bakker, the president of the Children's Tumor Foundation.
Thank you so much, Simon. I would like, as I said before, I really would like to thank everybody for joining us today. We all know that these are, we're going through very difficult times. Some people are really being, let's say, locked up in their houses. Other people can still walk out, others can still go shopping. So the situation is a little bit changing every minute, and we try to keep everybody together. So first of all, I would like to give you a quick update on the staff situation. So we have asked, because we were worried, there were more and more cases in New York City and closer to our office. So we have decided last week to have everybody work from home. That doesn't mean that we stopped working. So everybody is still working really hard. The only challenge that we have, and that you may see, is that the mail is being forwarded to one of our staff members to avoid that people have to go into the office. The only thing that, dependent on how COVID will further evolve, is that some check depositions may be delayed a little bit because of the bank situation. So we don't know exactly how that is going, but please bear with us. We're really trying to make everything work. Our main objective is to really care about our people and about you. And therefore, have we done two things. One is we're trying to do events like the events of today. And I really would like to thank Bruce and Scott Plotkin, our two lead medical advisors of the foundation. Dr. Bruce Korf is the chairman of the medical advisory committee for many years for the foundation and has always been present and available for all the crazy ideas we had over all those years. Dr. Scott Plotkin is the chairman of the Clinical Care Advisory Board, and Scott is a very active participant in everything we're doing, and he's very actively leading clinical care programs within the foundation. So thank you for being here. Thank you, everybody. I see 137 participants. This is the first time that we're doing something like that, and this is probably a first time ever that a lot of people are trying to do these kind of events. So we don't know exactly how this is going to pan out. We hope everybody is a little bit patient with us, that if not everything goes perfect, we will be looking at what other organizations are doing to do this even better. But what would be important at the end of this call is that we learn from you what you think would be a good thing going forward. Do you want to do this again, or do you say like, no, please, this is so miserable, never do it again? So Simon, if you give me the share screen opportunity.
And one thing I'll just say is someone pointed out, and because we've been hearing it, if everyone can mute themselves, if we've unmuted you, because we're hearing someone's phone ding in the background. So if you can either mute your phone or mute yourself, please take care of that. And sorry, go ahead, Annette. And as Annette said, we're gonna, just pardon any imperfections. We're working this out. This, I think, is the largest NF online video chat ever. So we're gonna sort through this. So far, it's going pretty well, I think, but go ahead, Annette.
So the first thing I wanted to start with is to remind you what of a connected community we are. And as I have been saying over the last couple of days, no virus will kill that. I think, as you can see from this very energetic picture, whether it is our patients, our volunteers, our clinicians, our researchers, everybody is really super active and super connected to each other. So when I have a moment that I'm a little bit down, I look at this picture and I'm like, we'll get through this. The second thing I thought was nice to throw on screen today is, and I call this hope, is that, as you may have seen, Wednesday, the NIH has announced that the selumetinib study has been published in one of the biggest medical journals that are used for research. It's called the New England Journal of Medicine. And as you can see, the group of extremely committed clinicians that most of us know have been very active in running this trial. So that is another moment of hope that I think we may be looking at some very good news very soon. So with that, I would like to say, put these two slides on your retina just for moments that it's all a little bit harder. But what I would like to do now is really turn the microphone to Dr. Korf and Dr. Plotkin. And there were two questions, or in fact, three questions that we keep getting from the constituents, and we thought to maybe ask Dr. Korf and Dr. Plotkin to give us a little bit of their opinion about this. So the first question is whether NF patients are at higher risk for COVID, and what would be your reaction to that, Dr. Plotkin and Dr. Korf? Do you want me to read the three questions, or do we do one at a time?
One at a time, and I think Dr. Korf can lead off.
Shall I start? And
please.
So the question are people with NF at higher risk of getting the COVID-19 infection?
Yeah.
Yeah. So are there correlations between NF and COVID-19? Is there anything particular that NF patients should be doing as opposed to the general population?
Okay, so I think the first and foremost point is that we recommend that people with NF follow the guidelines that have been issued for the general population. In the US, that would be the CDC. I don't know if we have international participants or not. That would be, probably the most important risk to, avoid contact with other people to the extent possible. The social distancing would apply equally to people with NF as it would to anybody. I think there's fundamentally two questions, though, that are probably in the back of people's minds. One is a person with NF at greater risk of developing the infection in the first place? And the second is, if they were to develop it, are they at greater risk of developing complications, of having a severe course? And I guess to the first question, is a person with NF, and of course we all have to remember NF is not one condition, it's at least three: NF1, NF2, and schwannomatosis. But to my knowledge, and I don't know that this has been thoroughly studied, but to my knowledge, from an immunological point of view, I'm not aware of any reason why a person with any form of NF should be more vulnerable unless they're on some kind of a medical treatment that affects the immune system. This would, of course, be true for anybody who's on an immunosuppressive treatment with or without NF. So there's plenty of people in the world that have various kinds of medical conditions where they're treated with things that suppress the immune system, and any of them are probably at greater risk of developing the infection. And if a person with NF happens to be on such a treatment, they too would be at risk. But having NF per se, in my judgment, at least from what we know, impair the immune system in a way that would predict that they would be at greater risk of developing an infection. As far as their ability, or let's say as their risk of developing complications, I guess the only thing that I can think of that would be potentially relevant, aside from if they're on a treatment that suppresses the immune system again, is if they have an underlying lung disease. And of course, this is true for anybody in the general population too. A person with an underlying lung disease, realizing this is an infection that attacks the lungs mostly, you would have to be concerned that they might be at greater risk of developing pulmonary complications by virtue of already having some kind of lung disorder. The question is, do people with NF, are they at risk of pulmonary problems other than what's in the general population? And the answer there is, I guess somebody who has really severe scoliosis that impairs lung function, I could imagine that might be a combination that would be concerning. Most of the time, the people I've treated who have had scoliosis, it hasn't been so severe that their lung function is impaired, but in theory, it could be. I guess if you had really large neurofibromas in the chest that also compress the lung, it possibly could reduce the reserve of your lung capacity. Once again, it's rare from people I have followed for that to be a big problem that requires treatment, but I could imagine theoretically it could be. And then finally, and this is something we don't know too much about, but there are people, mostly adults, in my experience, mostly older adults, who have a underlying lung disorder that seems to be part of NF that impairs lung function. And I would presume that a person who has impaired lung function by virtue of this might be at greater risk of developing complications. We actually don't know how common that is. In terms of it being clinically evident, I find it not to be very common. It only has come up a few times in all the years that I've treated NF patients. They tend to have sort of emphysema-like changes. And we think that may be a rare complication of NF. It probably needs more study to see how truly common it is. I've never seen it in a child. It's always been in an older adult. So I can imagine that would be a not good combination, but we have no idea how frequent it is. I'll defer to Scott for NF2 and schwannomatosis. I've been talking mostly about NF1, and I think Scott might chime in on both NF1 and the other two forms of NF.
Thank you. And I agree with everything that Dr. Korf mentioned. And I think I have a couple comments, but I'll just finish up the NF2 schwannomatosis maybe, and then make some more general comments. I think the same principle applies. We don't know of any reason that individuals with either NF2 or schwannomatosis would be at increased risk either for catching the COVID-19 disease or for severe manifestations of it based on the fact of having either NF2 or schwannomatosis. Instead, it probably has to do with the individual manifestations, such as we were just mentioning lung disease in NF1, or scoliosis or impaired lung function from any of the various reasons it can happen. And so I think the general answer to the question is no, we don't believe there's any increased risk. And the specific answer is it really depends exactly on what's going on in your own health world. And if that's a concern, if you know that you have impaired lung function in some way or an impaired immune system, it would be good to reach out to your doctor to confirm that. I'll give you one example of somebody who reached out to me who has a condition called inflammatory bowel disease that can be treated with a number of medicines. Some of those medicines work like aspirin, they're anti-inflammatory, and some of the medicines are true immunosuppressants. It turned out that this person was on the aspirin formulation, which does not increase their risk, as opposed to other individuals with the same condition who would be on the biological agents that do suppress the immune system. So for individuals who know that they have conditions that contribute, not the NF directly, but the manifestations, it is always reasonable to check with your team. One of the things to emphasize, I think, more generally is that with any new virus, we have very limited data, and Dr. Korf was already mentioning that. And so how do we think about what the risk for NF patients might be, given that this is new? And I think we're basing this on a couple of observations. The first observation I would point out is the seasonal influenza and other respiratory conditions, which are very similar in many ways, obviously not identical to the ongoing COVID-19 and coronavirus pandemic. And to my knowledge, we don't believe that NF patients are at increased risk for seasonal flu, influenza. And so that's one piece of what I would call indirect information, that we don't believe that NF status per se raises risk. The second piece of data that I would share with you is that early reports out of China and Europe are things that we're processing as quickly as we can. I saw a report recently about I believe, close to 50 or 80,000 patients in China when this publication came out. And when they looked at that, they did note that patients with cancer, some types of cancer, particularly lung cancer, were at increased risk for severe manifestations of the COVID-19 disease. But what was fascinating was that was only 18 patients out of tens of thousands. And what that means to me is that with rarer conditions like NF, at this point in March 2020, we have such little data that we can use and say these number of patients with NF have COVID-19 and this is what it meant. So we don't have that information today for the reasons I just mentioned. So what are we doing about that? Well, many of us in the NF community, under the auspices of the Children's Tumor Foundation, are thinking, how can we get that information? And so we're trying to pull together some thought leaders to figure out what's the easiest and best way to do that. Because NF is so rare, I don't think it will be prospective. What I mean is, I don't think we'll be looking every week and asking, did anybody get NF? Because it's too difficult with a rare condition. More likely what we'll do is, after a number of months, we will try to collect data from any clinic in the NF clinic network that has heard about patients or have been hospitalized at their facilities and try to collect that information. Will that research plan work? We don't know, but we're very interested in obtaining as much data as we can, because at this point, we don't know if this will be like the MERS or the other conditions that peaked and then went away, or whether it will continue to be seasonal. And we're going to put a lot of effort into getting the best data we can for the NF community.
So what is maybe an interesting question, as you guys are speaking, I'm kind of seeing what people are responding to. What might be interesting for us as an exercise to do is some people ask, you know, if you are on a MEK inhibitor, are you then immunosuppressed? And is curcumin protecting us? And is Glipec, is trametinib? I think what might be interesting is maybe for us as for the clinical community is maybe list those drugs that are known potentially having an effect on the immune system, so that people can be extra cautious, because some of them are and some of them aren't, but it might be an interesting piece of information for us in the line of COVID to say, if you're under chemotherapy X, Y, or Z, consider yourself immunosuppressed. So thank you. So the next question that keeps coming up is, of course, with regards to people, how should people react to their regular NF appointments? So as we all know, our NF patients undergo regular MRIs, regular doctor's appointments. One, what should they be worried to cancel those? Should they even cancel them to avoid going to the clinic? And you know my love for telemedicine. So could you both of you maybe comment on that topic?
I can start. So I can tell you that our hospital, and I suspect this is probably true for most right now, are not permitting what you might call non-urgent, routine clinical assessments and visits to take place. The hospital is basically totally focused on providing care for people with the COVID-19 or other urgent medical issues that might come up. So routine visits for, kind of routine surveillance, follow-up, new diagnoses are not actually being permitted. So we can't just run a clinic on a face-to-face basis in our routine kind of way at this point. People on clinical trials will still be seen, and anybody with an urgent issue for whatever reason would still be seen. We actually are moving to a telemedicine model. So we have the ability to do either telephone or even video visits, and we actually are invoking that for our NF clinic. It turned out this week, not only, of course, were things changing so quickly, but because there had originally been a genetics meeting that was supposed to take place, it ended up being canceled, but we had closed our clinics anyway, just because we didn't expect to be in town. That gave us a little bit of time to get things set up. So we have some patients that were scheduled for clinic next week, and we're offering those people a telemedicine visit if it makes sense, which it does for most of them actually. We can at least talk about issues that may be concerning them. On video, we can actually see certain things, skin lesions, for example, or a general assessment of neurofibromas. And of course, we can also access imaging data if there was imaging done. We can talk about genetic testing, either results already obtained or how to obtain them. I don't think we're going to be able to draw blood right now to do a genetic test that easily, but we can at least put them in a queue so that when things settle down, that can happen. So to be honest, I think this may turn out to have value going forward. It's been something we've wanted to do for a long time, because at least in Alabama, you know, it's a big state. People travel long distances to come to clinic. Sometimes a face-to-face visit is really important, and we'll certainly continue to offer that once the pandemic kind of tones down. But there's many people that we see where the most important questions have to do with imaging and interpreting what it showed, and where seeing them physically is not necessarily as important. And my hope is that the telemedicine that we establish now under this kind of emergency situation will pave the way towards some kind of a hybrid clinic going forward, where we do continue telemedicine visits where it's appropriate and face-to-face visits where that's appropriate.
Again, I agree with everything that Dr. Korf said. We've been doing televisits for about 2 or 3 years now, and now that's ramped up 1,000-fold at our 1,000% increase since the start of this. And I think that the key here is that deferring any non-urgent stuff is really appropriate, I would say, in this setting. And for the vast majority of our patients, that makes a lot of sense. I do think that there are occasions where people need to be seen, and that really just requires communication with your team. So again, it's on a case-by-case basis, but I think in general, most of us are deferring these visits for now.
Just one other thing probably just to remember is that when you do telemedicine, the patient has to be in the state that you're licensed in, because we see a fair number of patients here who travel from a distance outside the state to be seen. And the state licensing laws would prevent us from doing a telemedicine visit for a person who's out of state, because we're not licensed in neighboring states or anywhere else besides Alabama, actually. And that's probably generally true. There might be some places where people are licensed in more than one state, but I think the more typical situation is that you have to do telemedicine within the state where your medical license applies.
I will tell you that's changing rapidly. It's a this will emphasize how confusing it is for your healthcare providers. We were given guidance this week that that exact thing did apply until this week, and now because of these emergency regulations, these emergency issues, we are going to be engaging that. And I think it emphasizes really the key point I wanted to bring up, which is Dr. Korf covered, which is I do think if there's any silver lining to this mess, I think it's going to fundamentally change how the regulators understand the delivery of healthcare. The doctors and nurses and other people have always wanted to adopt more technology for our patients who travel far and so on and so forth. And for a variety of regulatory reasons, it's been impossible. I do hope that this will upend that and really make, especially for a rare condition like NF, will really help us advance some of our care.
That'd be great.
We're getting a couple questions in from folks.
You want me to do the last one, Simon? Because I see that some of the questions are related to the last one that I had for Dr. Korf and Dr. Plotkin with respect to clinical trials. So the first question is, if selumetinib gets approved, will people have access to it? And then the second is, if somebody is going to go on a new trial, and especially if that new trial would be an immunosuppressant, would it be wise to delay that for the time being? And then, of course, the brigatinib trial, if that one opens, will patients be able to benefit from that? Kind of, you know, it's about the drug world, right? What is the effect on drug administration to our patient?
You know, I would say that it somewhat depends on the urgency of treatment and the nature of the treatment. You know, for example, if you have a malignant peripheral nerve sheath tumor, you very well may wind up on a chemotherapy or potentially a clinical trial that is immunosuppressive. But if you're faced with a life or death kind of decision, if there's a really urgent need to treat, you know, that may just be a risk that has to be accepted, and you then have to take precautions, kind of exceptional ones, to try to avoid. So I could imagine circumstances where, you know, if you have a severe enough problem, you just are going to be faced with a hard decision, but it may be necessary to treat. On the other hand, if it's a more elective treatment, something which isn't as urgent, if it were an immunosuppressive treatment, you'd have to think very carefully about whether now's the right time to start that if you have a choice to wait. So that has to be individualized between patient and doctor as to what's the wisdom and what are the risks and benefits of any particular treatment at any particular point in time, and really have to think carefully about those kinds of issues vis-a-vis initiation of any kind of treatment or clinical trial.
And I would just add to that, that for those patients who are enrolling in trials now, for most centers, there's a skeleton crew involved, and people will be getting much less attention to surveillance and safety and other issues by nature. And so in some ways, if you can defer it, it's in your interest to defer it because the infrastructure is not nearly as robust right now. And just to add one last point, I'm not aware, and I believe there's no evidence that selumetinib is immunosuppressive. And so if you are currently on that drug, I don't consider that to be one of the immunosuppressant drugs, nor do I consider brigatinib to be immunosuppressive in the traditional sense. Nor do I consider bevacizumab to be a drug that's primarily immunosuppressive. So I think for at least those three, that would be at least my personal feeling. The only drug class that I would put in this category would be what we call the Mtor inhibitors, which can include sirolimus, everolimus, and there was a study drug that some of us have been using called AZD2014, called vistusertib. And those drugs and related, or temsirolimus is another one that I've seen used. Those medicines do have some immunosuppression role. And I think I wouldn't say don't use them. I would just say speak to your provider if you're an individual and know somebody who's being treated with this class of drugs.
So we just have a comment from Vanessa Merker. This is going back to the telemedicine topic. I can confirm that the Department of Health and Human Services recently waived state licensing requirements for telehealth for all national health insurance plans, Medicare, Medicaid, and CHIP.
Thank you. I've learned something here and appreciate that.
Simon, can you, what was the next topic for the discussion today?
So we have we had people asking us about some CTF type events. Well, if people have patient-related questions, please put them into the chat function. We'll get to those. I'm going to call on Michelle Perpisny, our Chief Advancement Officer. You've probably read our notes, but people have asked us about what's happening in the next couple of months with CTF events. Annette, did you?
Yes, there is one thing, Simon. I keep seeing Mekinist.
Yes.
Mekinist is another MEK inhibitor. I suppose the same thing applies to that, to Mekinists. Mirdametinib, selumetinib, benimetinib, they're all in the same box of MEK inhibitors that are not supposed to be immunosuppressive, right?
Yeah.
Right.
Okay, sorry. Okay, good. Yep.
That's great. Someone said, please put spellings of the drugs in the saved text of the webinar. Yes, we'll do our best to get everything there. Michelle Perpisny, I've unmuted you. So the question is, what are CTF's plans for events and for volunteers as we go forward the next couple of months?
Thank you, Simon. Hopefully everybody can hear me. And I want to appreciate everybody's time and effort being on this call today, because I know how important it is to our NF and CTF community. So first and foremost, in light of everything that is happening, we are postponing and rescheduling as many events as we possibly can between now and the beginning of June. Many of the staff that you work with are already talking to the volunteer organizers, and hopefully many of the fundraisers talking about where those events have been rescheduled or via postponed. Please make sure that you go to our website, because we will be updating that website with information. As of today, all web pages for events, whether that's a walk, whether that's a run, whether that's a special event or a golf outing or a youth classrooms program, will be updated with information about COVID as to whether or not it's been postponed, or if there is a new date. That will also be noted on the calendar. We certainly are looking to move everything. There may be a few events that do get canceled, but we are trying to postpone and move everything to the fall. We are also looking at many virtual opportunities, from virtual races to virtual stepping, hopping, skipping, jumping type programs, to virtual programs for the youth to continue to participate in the classrooms program. We know that people may have questions about what's happening with the upcoming conferences, our volunteer leadership conference and our annual forum. And we are still in the process of analyzing the situation at this moment in time. But once we have more details, if those are to be postponed or rescheduled, we will absolutely send an email out to everybody, and you can go to the website, and we'll be updating that regularly, as Simon said, with new updates and information about events and new dates and rescheduled programs. If you are also thinking about what's happening with my upcoming clinic program, most likely those are being canceled right now or postponed for the future. And again, that will be updated on our website at ctf.org.
And someone asked about camp. I don't think you mentioned it, Michelle. So camp is still on for the time being. It takes place in mid to late July. If anything changes, we'll certainly communicate that. We do have, go ahead.
One thing about that, just so people are aware, there have been a lot of reports out of China suggesting that individuals under the age of 30 and primarily under the age of 20 are at very low risk for severe disease. And while that general statement probably holds true, new data from the US and I think Europe suggests that it may not be as clear cut as that. So meaning that young people are still at much reduced risk for severe disease compared to older individuals, but I think it would be unwise for anyone to just assume that if I get COVID-19 is no big deal and I won't have any severe disease. I think caution is much more reasonable approach than relying on data, the early data to come out of the infection.
Yeah. Thank you, Scott, for that. And in regards to camp, as Simon said, I think we are taking a look at all of that and assessing things every single day with all of our events. And I appreciate that comment because that hits home very closely.
This is probably for Scott, just it's specific to Avastin. Should Avastin given every 3 weeks continue as scheduled?
Again, I think what Dr. Korf said initially is just very important. It all depends on the risk and benefit. As I mentioned, I don't believe that bevacizumab is inherently immunosuppressant. So Avastin doesn't necessarily reduce your immunity. And so in that sense, if you're receiving bevacizumab and benefiting from it, my practice, at least at Mass General, will be to continue it. Now, there may be an occasion where if the hospital says, can any patients have their appointments deferred for weeks or even a month or two, I would say that for many, but not all patients on bevacizumab, we do have flexibility in the timing of treatments. So I guess the complex answer is, I don't see any reason to necessarily medically to change it, but I think practically to reduce people's exposure and to fulfill some of these hospital mandates, it would be reasonable in some cases to push out treatments. And I think the details of that you'd have to share with your medical team.
So I'm going to throw a question out there, and it could be for either of you or for some other folks I know we have on call. And these are on the call. Some teachers and social workers, I think, have joined us today. It has to do with the whole idea of social distancing and being a little more isolated, being at home, kids at home, and that kind of thing. So so if anyone on the call, I know Connie Sorman has invited some folks to join us who might have a little expertise there. I don't know if Scott or Bruce, you'd like to comment on any of that in terms of sort of the less obvious issues that NF patients face in this regard, sort of mental state and dealing with what's going on now.
Well, it's fair to say that the situation is stressful to everybody, with or without NF at this point. And there's, on top of just the immediate stresses of being at home, having to get your work done in an unusual environment, having your kids at home, if you have kids who are home from school, there's any number of things that are impinging on people. And yeah, social isolation is a not uncommon experience in people with NF. And now you're kind of shut into the home, unable to get out to the extent that you might have. So there are stresses that everybody is experiencing, and any medical condition, and NF is certainly an example of this, it kind of exacerbates, or at least has the potential to exacerbate, any stress that you might otherwise experience, because you're under stress to begin with, just by virtue of having the condition, and now you add a burden on top of that can make it all that much more difficult for people. And I guess the one thing I've learned over the years from taking care of people with NF is there are significant stresses that it entails. Now they're going to be only greater by virtue of this. On the other hand, I wouldn't underestimate the resilience and the kind of ability of people with NF to rise to challenges. And yeah, this is another challenge that we all share, and it's another thing to put on the shoulders of a person with NF. And on the one hand, I think one thing we see is just how strong people can be and how they can rise to enormous challenges. On the other hand, don't be afraid to reach out. May not be face-to-face at this moment, but it can still be through phone, email, all the different kind of mechanisms to support wherever you find it. That includes family, friends, social workers, mental health professionals, clinicians that are involved. And this is a time when we expect to see that people will be under stress, and any of the caregivers I've just mentioned, and I'm sure I've left some out, would be available. One thing I guess it's already come up in the context of licensing, which I wasn't even myself completely aware of, but many of the barriers that normally get set up in terms of communications, like email would be an example, are being relaxed to the point, realizing that we just have to communicate the best way we can. And so I just would encourage people to reach out if they feel there's a need that a professional or a relative can provide in difficult times.
I think we have a couple of educators on the call today that maybe be able to give some tips on what may be a good, some kind of good advice to people with NF kids at home. So Connie, you had invited a few people, so let's get started.
I've unmuted them. So Amy Bender, I've unmuted you if you want to go ahead.
Okay, this is my first Zoom, so I hope I'm doing everything correctly.
You're doing great.
Perfect.
So first of all, I want to remind families that this is an unprecedented time. This is something I've never been through, and I know many of our families have never been through. So first of all, your children's mental health, their ability to be resilient during this, they need comfort, they need reassurance that they are safe, that everyone is taking care of them. That's first and foremost before we talk about our education and what we're doing. For some of our special needs population, that schedule for the day is going to be most important. Those visual schedules that they can see so they can anticipate the day and what's going to happen. For homeschoolers and for younger children, we recommend 1 to 2 hours of academic work per day. And then for older, middle to high schoolers, we're looking at 3 to 4 hours of education per day. And that hopefully your school district has sent you some packets, some sort of online resources you can use. There's social stories for some of our special needs students. If you Google, it's actually a coronavirus social story, which can explain it to some of our students. But important too is learning how to cook, learning how to do some laundry, learning how to clean their room. You know, things like that are also educational, and I don't know if people always think about that. So I wouldn't be afraid to sprinkle in some of those life skills that might break up your day. Get outside if you can, a little fresh air. And again, most teachers are taking emails or phone calls if needed. I don't know if there's anything else specifically I can suggest, or if anybody else has any follow-up questions.
I know Hannah also raised her hand. So Hannah, early, if you'd like to also maybe.
Yeah, can you hear me?
Yes, we can. Go ahead.
Yay. So as more districts are, closing schools and doing education online, we're waiting on OSEP, the Office of Special Education Programming, to kind of address the compliance issues that go with educating special education students online. So because then the accessibility is an issue, and then also the specialized instructional techniques that they perhaps would need. The burden now becomes on the parent. So, as we're awaiting those directions and finding out waivers, et cetera, I know that I can only speak to my state, which is Florida. The governor said everybody matriculates to the next grade come the fall. And so it means that a lot of students with special needs either don't have access to education and may regress, as all children do during the summer. That summer slide is going to have to be addressed in the fall, and that's really for all states to address how they would move on with that. But I really like what Amy said, because part of the thing with children, whether you're 3 or you're 18, is that the function of a routine is to establish a home routine with your at-home children, whether they have special needs or not. And then you just have a schedule like we do so much at school, that this is when we're doing this is when you take a break, this is when we're going to do those life skill lessons, this is when you can go online, etc. So I think as everyone's scrambling to be relevant in this online community, there are a lot of resources out there if you do have access. With learning disability groups, Autism Speaks, the social stories, as Amy mentioned, are also good. And I know that Classrooms That Care advisory group is going to get together and perhaps talk about creating something where we can, guide you through all those resources. Thanks.
Right, and I've just posted a link in the chat function to our parents guidebook.
Perfect.
So, which is I think helpful, and then I'll also post a link to Classroom. Thank you for reminding us of that. I'm going to call. We have two other folks who raised their hand too. Next was Stacy DeSillis, and then Melissa Merlucci after. So, Stacy, go ahead.
Yeah, I just, Hannah and Amy hit on a lot of the stuff I was going to say. The only thing I would say about, virtual schooling is that if you are getting packets, that's great. But if you are interested, there's also a lot of online resources right now, virtual field trips that you can take to zoos with your kids, museums. There's every day at 1 o'clock, Mo Willems, who's a child author and illustrator, is doing a lunchtime doodle, which my kids are loving. But I would say, yes, it's a lot about, especially with my NF child, it's a lot about routines and really having the patience to understand that this is such a tough time for them as well. And they really miss their friends and they miss their teachers, because in my state, we're not in school. And I think that while teachers are providing a lot of students with a lot of material, it's okay if they don't finish it all. I think really we need to be worried about their mental well-being and keeping them busy, entertained, and in a routine. That's really what I think is most important right now.
Thank you, Stacy. And Melissa, if you'd like to chime in as well.
Sure. Yeah.
Melissa, I think we're having trouble hearing you. We just...
There are some drawbacks to the telemedicine.
I'm gonna say basically everything that they were all saying. And really, oh, can you hear me?
Yeah, I think Melissa, you're actually coming in.
Can you hear me?
You're coming in now. Now we can. So let's give it another try. So go ahead, Melissa.
So I know with my son, similar to what they were saying, we kind of set out a schedule and I show it to him and we talk about it the night before. And I think that's been really useful. And, think about just the way they do in school with reinforcements and lots of breaks. That's helped. And I know that a lot of districts around me have been doing like Skype with OT and PT and speech. They've been doing like Skype or FaceTiming to try to get those services in, because that is really hard to do, from a piece of paper or just in a packet that they send you. So maybe reach out to your providers and see if that's something that is, I know it's not allowed everywhere, but if it's allowed, that's maybe something that they can do with you.
Great.
So while you all are speaking, I see this, and again, let's say a thing for the amazing community that we have. I see a lot of educators proposing to compile a list of online resources for people to be able to go and to help their kids getting through the day. So thanks. This is amazing again.
Yep, that's great. So feel free. We've got about another 10 minutes. If anyone has any other questions, whether for any of the panelists, anyone who's spoken, if you have comments or questions you'd like to speak out loud, just raise your hand and we'll let you do that. While we're waiting for those to come in, I'm going to tag on to Michelle's commentary before about events. One of the other things we've been getting asked is about NF Awareness Month, which is in May, which a lot of that is virtual and digital anyway. But we are getting questions as to, one, whether we would postpone it just because the moment feels different at the moment, and what the plans were for the Shine a Light buildings, since so many of the folks on the call do participate in that. Our plan right now, I don't think Awareness Month changes. It's still in May. Hopefully by then, the mood will be a little different and situation will be better, but we'll just watch it and play it by ear. Until then, it will still be an NF Awareness Month. We think if we do get good news from the FDA, it'll still be a good moment for the community. So we'll just sort of play it by ear and communicate there. In terms of the Shine a Light campaign, which is so huge and prevalent. Last year we had about 326 locations worldwide light up in blue and green for the cause. We've already got 100 and something signed up. We're probably not going to push aggressively at the moment, but we'll be communicating later. If it turns out we're all still contained in quarantine, it'll be an opportunity, and maybe this goes to what we just talked about, what to do with your kids at home, to do some blue and green at home and do some digital and online awareness there. So, so just watch for that. If you're not on our mailing list, just shoot us a note to info@ctf.org, and we'll add you to the list, and obviously follow us along on the website too. Let's look at the questions coming in. And Scott or Bruce, feel free to speak up if there's anything else that you want to add. So we've gotten a few questions. It's a little unrelated to this, but for NF2, what is your standpoint on using curcumin supplements?
It's always a challenging question. For those people on the call who know me, they know that I always say that I'm trained in Western medicine and I have very little kind of understanding of a lot of the supplements. So I don't feel qualified, I think, to comment on the pros and cons of curcumin. So I neither discourage people nor encourage them. I do think it's always good to disclose to your team whether anyone is taking supplements in case they interact with any of the other medications. But I don't know if Dr. Korf has any stronger feelings, but these are.
I have nothing to add. I too am not an expert on alternative treatments of anything, NF included.
Okay. I'm sorry about that. That's a common question we receive.
Yeah, we had 3 or 4 people brought it up today, so I felt like I needed to read it out loud. So,
yeah.
Yep. The questions. Oh, let's see. Someone asked about scholarships if they're available for camp, and Julie has answered. Julie Pontilano, yes, scholarships are available for camp tuition. Julie, if you want to speak, let me know and we'll unmute you as well. And
maybe it might be nice, Julie, if you could also say a word about the Classrooms That Care program and maybe your plan of creating that, having that advisory board. And I'm sorry I throw you in the fire here, but I think the timing is right that people see your things associated to Classrooms That Care.
Yeah, absolutely. So, as we said earlier, camp is.
Make sure that everybody is on mute, that is not speaking.
yeah, I'm gonna mute everyone who's not speaking except for the doctors. So, go ahead, Julie.
Hi, thanks. Sorry. So, yeah, so for camp, we are taking it day by day. We're going to see that camp is still on and good to go. Scholarships are still available for camp tuition. And we are still accepting applications. So the applications are available at ctf.org/camp. If you have any questions, you can also contact me through that website. I'd give you my email address right now, but it's really long. And as far as classrooms, that was something that I did want to say. We're working on a virtual classrooms program that allows teachers to use NF as something as a teaching tool, creating writing prompts, a comic book creation, and I really think the comic book could be a lot of fun for a lot of the kids, take up a bunch of time. It's arts and crafts, it's fun. As well as some video items. More to come on that, but it is definitely a work in progress. We're jumping right on board, and we know that a lot of these teachers are also looking for resources, things that they can be sharing out. So it's a resource for them. It educates the greater masses as well.
So Julie, someone is asking if this is the Camp New Friends in Virginia or all NF camps in general. So maybe you just want to.
Sure. Yeah, absolutely. So the camp that we run here at the Children's Tumor Foundation is the NF camp in Salt Lake City, Utah. We partner Camp Costopolis. It takes place the last 2 weeks in July. So the first week is July 18th to the 24th. That is for children or NF patients that are ages 18 to 25. And then the second week is July 25th through the 31st, and that is for our younger half, and that is ages 12 up to 17.
But this is Annette. There is maybe one thing in general that I would like to mention is that we have come together as different NF funders in an organization called the NF Collective. So which is multiple organizations. I'm not going to name them because I'm worried I'm going to forget maybe one. But what is really important is that each of these organizations are organizing different camps. And when we started to talk about it, it became clear that all these camps are focused on a slightly different thing. They're more family-oriented camps. They're more special needs camp, like our camp, etc., etc. So we are working on that together with the NF Collective to say, if you want to do something in the NF space, whether it's advocacy, whether it is camp, whether it is any of those things, we will give you the full list of everything that is funded or organized by the different organizations. So just want to make sure that you know that. One of the things, I just want to put the elephant in the room. I saw quite some comments scrolling by of that there might be an effect on revenue this year. Although we don't know exactly what the effect will be, we're realistic enough to think that there will be an effect on revenue. But we are, for the moment, we're really on it. Michelle and the leadership team are doing the necessary calculations and budget reforecasting to kind of predict what will happen, although we don't know exactly. But we want to make sure that everybody knows that, yes, we are aware and that we're in fact very closely monitoring what is going on and what may the impact be on our revenue. I don't know, Michelle, if you want to say anything about that, but I think for transparency, since these questions keep coming up, I think it's important that we address them.
And Michelle, I've unmuted you, and we know that just to tag on to what Annette said, it's affecting not just us, and it's the good point Annette made about the collective, it's impacting other NF groups. We just heard that Texas NF just had to cancel their lead event this spring too, so it's something that we're all going to look at together, I think. So it obviously impacts the whole community. Michelle, you're unmuted if you want to chime in.
Thanks, Simon, and thanks, Annette. And as Annette said, yes, we are actually, we certainly are taking this very, very seriously, knowing that with events being postponed to the fall, being canceled, many people being very, very affected by this, knowing that the economy is, everybody is affected, right? I mean, left and right here in New York, where just everything is closing except for the supermarkets, the laundromats, and the and anything that is deemed essential. So we're very sensitive to the fact that people will be out of jobs, and it will be a very, very difficult time for everyone for quite the foreseeable future. So we are looking to project a revenue loss, as Annette said. I have been speaking with my development team, and as Annette said, the leadership team at CTF. And one thing to note is that in looking at the research from the last global recession, or at least the recession here in the US in 2008, the average losses to charities were about 5.4%. Now, granted, there were some charities that lost more money and some charities that lost less money. We are looking at projecting a loss more than that because I'd much rather be realistic. But I will say, as we said last night on a phone call with many of you who are on the phone with us today, our walk organizers, the NF community is most important. So the health of that community, the community at large, and how we get together and how we work together is most important. Certainly we need the fundraising to be helping Bruce and Scott and the researchers push forward, and this is such an incredible time, and our resolve to fight NF and continue to raise money for the research for NF has never been stronger. You all need us more than ever before in every way, shape, or form. But that is one of the reasons why we are also looking at various virtual opportunities, which we would love to be able to tell all of you about as we get more details and more clarity on exactly what they're going to look like. I know that the endurance team is looking at virtual opportunities. I know that Julie's looking at virtual opportunities for her classrooms program. I know that we're looking at a virtual global opportunity for everybody to participate with their families by taking steps or jumping in place or hopping. So a lot of this is being evolved as we speak, and I think it will be a great opportunity for us to launch these virtual programs to reach our NF audiences who are affected by NF, but who may not yet be connected with CTF. And we can provide people with an opportunity to be engaged and involved. That said, we are certainly aware that there are going to be a revenue loss for us this year, but we are looking at mitigating those losses as best as we can. I would love to be able to update you all in the coming weeks on exactly what those plans are and what we're looking at from a perspective of our overall budgets. But we won't stop fighting. As I said, more than ever before, you all need CTF more than ever before, and we're here for you in any way that you need that, whether that is putting more money into the mission, funding more research, and as well ensuring that you all have the opportunities like this to be together. As Annette mentioned, great news. I want to reiterate some other great news that was in last year, and that last year we had such a banner year fundraising wise, and maybe that was a great thing at the end of the day, because we were able to commit $8 million directly to the Discovery Fund so we can put more money into our bench to bedside research program, so that we can ensure that we continue to drive research, to test new treatments, to get them to you all for your family members, and for those of you who are directly impacted by NF.
Okay, thank you, Michelle. I know Annette had some fundraising ideas she wanted to share with you on the call, but I don't know if the video is coming through. We're running out of time, or we actually are at our time limit. There is one more patient question that has been waiting for a few minutes. If Dr. Korf or Plotkin don't mind. Son has NF1 and asthma. Can asthma meds interfere with corona treatment if he got it? Also heard that ibuprofen can complicate symptoms of corona. I don't know if either of you feel comfortable answering that.
I don't know about Scott. I don't view myself as an expert on treating the lung involvement in coronavirus. I would really, when it comes to any particular medication and how it might interact with other medicines used in the treatment of the coronavirus symptoms, I would have to defer to the doctors who are experts in that area. So I think it'd probably be better for me not to speculate on any particular asthma medication or anti-inflammatory that a person might be on. Scott, you're muted.
And the only thing I would add, I agree completely, is that this is an example where speaking with a provider can be very helpful. Obviously, mild asthma, which is many, many people, is probably going to be very different than patients with severe asthma who require a lot of medicines and have frequent exacerbations, meaning frequent episodes of worsening of symptoms. So, you know, the details are important, and I think that's a reasonable question. I would just say not to jump on to all the news that we all hear about. This drug looks good in Italy and that drug looks good in China. I think the medical community is definitely in flux now. We're all hoping for some medical treatments, but some of the stuff that's being put out now is probably not super reliable. So just beware of that.
Simon, can I just make one comment before we end?
Yeah, go ahead.
We haven't talked about the research efforts in NF, and I guess people might wonder what's happening. Is that everything kind of on hold? And the answer there, from what I know, is that like anything else, people are, we're dealing with sort of skeleton crews in a lot of the research efforts. However, like if there are animals that are being taken care of in research, that goes forward. I can't tell you the number of teleconferences I've been on planning research efforts and talking about how to continue them. So this is, it's definitely made a difference in terms of how we do research, but the research community has continued to be very actively engaged in NF, and this is not going to stand in the way of progress. We have now daily teleconferences within the NF Clinical Trials Consortium of the leadership, just trying to make sure that our clinical trials go forward, and even new ones will still be launched. So people shouldn't think that the research community is just standing by. There's a lot going on behind the scenes.
Yeah, exactly. Thank you so much, Dr. Korf. Exactly. There is a lot of administration that goes about some of the research and clinical trials, and all that can now just be accelerated because people can't do other things, right? So at the end of the day, first of all, we will get through it, And then the second thing is that people are not stopping to work.
Yep.
Great. So we've come to the end of our meeting here. If there's anyone else, please, you've got another 30 seconds to chime in. And I think Bruce's, what Bruce just said, Dr. Korf just said was a nice recap. Scott, I don't know if you want to do a recap at all, and then otherwise we'll close it out with Annette. So.
In a very typical moment, I'm getting urgent messages about COVID-19, so I missed the conclusion, so I apologize. So I think I'll pass on making a final comment. I'm sorry, I'm just texting with my team.
That's exactly, I think we've all been doing that this week, so that was perfect. Annette, if you'd like to close us out.
Yeah, first of all, thank you so much, Dr. Corbin, Dr. Plotkin, for joining us today. Thank you for the very wise advice of the educators. I learned a lot today, so thank you also for your input. We would love to do more of these. What would be interesting is that we would get topics from you, and then people that would feel that they, you know, like what the educators did today, right? What is something that would be of importance to the community that you know, that you have learned? We can also throw some fun in it. I promise I won't share my video today, but I'm happy I'll throw it on my Facebook so you can laugh or not afterwards.
All right, go ahead. Annette wants to show this. You want to go ahead? Go ahead. You know what? It's okay.
I yelled at by Michelle afterwards. So.
I'm gonna do it because Annette wants to. So one of the things, and this actually is a good topic too.
Yeah, I love this one.
As we close out, so you know, and Ellen DeGeneres did something like this too. So it's not just us. You know, we also launched a joke telling initiative for kids with NF. So if you follow us on social media, you'll find that we think, as serious as everything is at the moment, and certainly it is. You've heard that in the call. It's important that we, you know, still try to keep some humor, as we can say. So Annette yesterday, and we didn't tell our advancement officer about this, Michelle, but Annette came up with some new fundraising ideas. So let's see if this works. There you go. And with Dr. Plotkin's background and Bruce's background too, I think, go ahead, Scott. Looks like you want to say something.
What happened to the end of it when he puts up the little thing? That's the best part.
Oh, I don't know. That's all we had here.
Oh, I have the end of it. I'll send it to you. It's really funny. I'll have to send it. It's great. There's one more piece to that clip. It's really funny.
But I think it would be good to end a little bit and let's never lose our humor. I think we are a very strong community. It's a little harder than normal, but you know, we can get through this. So with that, I really would like to thank everybody for today, and let's throw out some ideas for a next call. Let's keep the humor high, and let's still make sure that we care about each other and keep our community connected.
Thank you for sponsoring this.
Yeah, thank you.
You have on screen our website, ctf.org, and follow us on social media as well. So, and email us at info@ctf.org. Thank you, everybody. Thank you, Dr. Korf, Dr. Plotkin, Dr. Bakker, everyone else who called in. We'll be back again soon.
Right.
Bye-bye.